Who came on the line, please? Hello?
Hi, this is Angie.
Hi, Angie. It's Bruce. Thanks for calling in.
Okay, thanks, Bruce.
No problem. We haven't started yet.
Okay.
Good afternoon, Bruce.
Good afternoon, Madam Chair.
Bruce, are you okay to go ahead and I'll call the meeting to order?
We are prepared to proceed, Madam Chair.
We'd like to call the meeting to order. Welcome, everyone. And will you go ahead with roll call, sir?
Yes, thank you. Dr. Jameson? I know you're present. I know you're present. Okay. Dr. Grinstein? Ms. Lewis? I can see you there.
Sorry, I didn't push the button.
Okay, thank
I'm
you.
here.
Thank you. Ms. Wilson?
Here.
Ms. Clark?
Present.
And our newest member, Mr. Melendres.
Present.
And welcome, sir. Now our ex officio members, Ms. Aiello,
Present.
Mr. King, and Ms. Nielsen.
Present.
We have a quorum, Madam Chair.
Thank you, Bruce. And we would like to start by inviting any public comments. And shall we start right here? Is there anyone who would like to make a public comment? Seeing no public comment down here, is there anyone in the north who would like to make public comment?
There appears to be no one wishing to make public comment in the north.
Thank you. So, shall we go on to the minutes for October 8th, 2015 board meeting? Ideally, everyone's had an opportunity to review what was posted as the draft and appears to be the final. I don't see any changes from the draft that was posted to this final minutes. Do I hear a motion to approve the minutes from our board members?
Madam Chair, this is Angie Wilson. I'd like to make a motion to accept to approve the minutes.
And
Second
a
that.
second, please.
Valerie Clark,
Okay,
second.
thank you. So it has been first and second. Any discussion? Everyone in favor of passing those minutes, please say aye.
Aye.
And is there any opposition? Thank you. The minutes from October 8th, 2015 board meeting are passed. And Mr. Gilbert, we always look forward to your report. Thank you.
Thank you, Dr. Jameson. My report will be oral rather than written, and I'll explain to you why that is in the course of my report. You know, obviously it's here, open enrollment for plan year 2016, and I would be, I think, remiss if I didn't say it's been a very busy and crazy time for the staff here at the exchange. Our first year of open enrollment and our second and our third, they've all been very different, and this one is certainly unique. Our first open enrollment for the 2014 plan year, there was a lot of excitement, but ultimately there was a lot of disappointment and dissatisfaction. Last year's open enrollment for the 2015 plan year, it looked like we started to get it right. The platform worked, people were able to enroll, and we about doubled the number of folks who were insured through the exchange. Now this year, 2016 plan year open enrollment, has been what I call the year of outreach and education. I've spent a good part, actually the last 2 months, bouncing between Reno and Las Vegas and speaking about the exchange and what we do and how we can help those who need coverage and how to get assistance if they need assistance with enrolling and the financial assistance that may be available to them. I've met with the editorial boards of the newspapers in Las Vegas and Reno. I woke up with the Wagners at 6 a.m. there in Las Vegas, which was an interesting time for me. They're very, very pleasant at 6 a.m. there. I've spoken with legislators. I've had letters published. I've appeared on Ralston Live. I've taken part in radio interviews, spoken with people from the Associated Press. We've appeared before the BOE, and frankly, we're appearing on Monday before the interim committee on health care for the legislature. So our dance card has been extremely full. Our message, however, has always been the same, and it's sort of twofold. First, that having health insurance is important, and secondly, that our job and what we do is to help assure people have access to that insurance and to provide people who don't have the opportunity for a group health plan through their employer and otherwise wouldn't be able to afford coverage for themselves or their families, a tax-advantaged contribution toward the cost of health insurance, just like those that are in employer-sponsored plans are able to enjoy. We've just finished the first 10 days or so of a 3-month open enrollment marathon. And we're not going to know how we're doing for some time. But it doesn't seem to matter because anymore my life is filled with 2 questions. Number 1, how many will enroll? And number 2, when will we have numbers? Those are the 2 questions everybody asks me. The truth is, if you take a look last year, by the end of December, the first numbers that we came up with, we had 10,000 enrollees. And that had me a tad uncomfortable, but you may remember that we ended up with just over 73,000 people going through the process. So the early numbers didn't really tell the tale. And it's going to be just as confusing this year, frankly. CMS has suggested that it's going to be difficult to directly compare this year to last year, especially on a on a week-by-week basis or a month-by-month basis, because, for example, open enrollment started on November 1st this year as compared to November 15th last year, which means that from the start of open enrollment to December 15th, when people can sign up for January 1st coverage, is longer this year than it was last year. And everybody understands that folks, when they're signing up for health insurance, are deadline driven. That's simply the way of the world. And so it's going to be interesting to see the deadline effect. So I don't know where we're going to be by the 30th of this month or even the end of December. The other thing that's sort of interesting is the early numbers will probably include a fairly significant number of passive or auto enrollments. CMS is sending passive re-enrollment transactions to our insurance companies in 2 waves, and the first one actually went out on October the 15th or thereabouts. A second wave is going out on or about December 16th of this year. Now, we believe that most of our consumers will qualify for open enrollment, although we do not suggest that to them, and we always suggest, and fairly forcefully, that they sit down, take a look at the plans as they presently exist, their current income situation, and the financial assistance that may be available, which is not always taken into account in the course of auto re-enrollments. But the truth is, we're just not able to pin down a number. We don't have any experience in that. We've never had a re-enrollment before. We don't know what it's going to look like. Additionally, there are thousands of people who are going to have to actively re-enroll as a result of Assurance and the co-op leaving the marketplace. It's important, I think, to understand that when we talk about these auto re-enrollments, that they don't stop or preclude a consumer from ultimately deciding to change plans. Consumers can always go on and actively re-enroll and choose another plan than what they have right now. Passive re-enrollments are automatically replaced with active enrollments that are initiated by consumers, and those selections in active enrollments are honored. In short, because there's so many things that are different, it's a brave new world again. But I think it gives us a better opportunity to establish what would be a true baseline for us in terms of expectations going forward than our prior 2 years. But I guess we're going to have to see. And when people ask me how many and when, I basically always tell them the same thing, which is we've done all the work that we need to do. We've dotted the I's, the crosses, we've crossed the T's. We've taken all the steps necessary and done everything that we can to make this a successful enrollment effort. And as long as we have done everything that we can, how many isn't really something that we can control. But we will own the work, and we're going to have to surrender the result. We'll see what happens. But the truth is, I feel good about where we are, and I think we're going to be okay. And that would be the sum and substance of my report, Madam Chair.
Thank you, Mr. Gilbert. Are there any questions for Mr. Gilbert on his report? I would just like to say I do believe you have done everything that we could have done. Especially, I want to comment on how good the website looks and is working. I've heard so much positive feedback, especially when it comes to find somebody in your area to help you, and they can put their zip code in, and also the calendar of events, so that people can find more out and be more engaging with someone. So it really is well done to your team, sir. Were there any other comments? Okay. I think as most of you noted on the agenda.
Madam Chair, I
Yes.
believe that Ms. Clark had a comment.
I just have a quick
I'm sorry,
comment.
I didn't see that hand.
That's
Please
okay.
go ahead.
Valerie Clark for the record. I would just like to commend Mr. Gilbert as well. I happened to see one of his TV interviews, and I forgot which one it was, but it was where you were addressing the gentleman who was, Terry Hendry's piece here in Reno, where they were trying to help a gentleman who was having quite a bit of problems. And ultimately, after being questioned, they realized he was working with an online service that had no local presence and was not part of any government entity, and he was being done a very great disservice ultimately, and Bruce was able to help him and guide him to sources that were more appropriate to help him get what he needed here, and that is basically advising the local people here in Nevada to work with local assistance, whether it's a navigator or a broker. People in this area are going to be much better prepared to help the consumer than going online and dealing with a service where there's no name, there's no face. And so I was very pleased to see that you were able to help him get to the bottom of that.
Thank you, Valerie. And as many of you saw reviewing our material prior to the meeting, that much of today's meeting is really wrapped around marketing and open enrollment update. And so shall we go ahead and proceed with that?
Thank you, Madam Chair. Janelle Davis, Communications Officer for the record. The marketplace for enrollment, as we all know, began Sunday, November 1st and goes through January 31st, 2016. Nevadans need to know and plan for important dates and understand the process of applying and enrolling in QHP's qualified health plans through the exchange for plan year 2016. Penna Powers is here today and will present on the status and accomplishments of the marketing and outreach campaign, as well as discuss our kickoff events in both Northern and Southern Nevada, which were on November 1st. Our advertising campaign kicked off October 26th, and all media ad buys have been placed. The Nevada HealthLink website has been updated to reflect 2016 open enrollment, with our in-person assistance tool, key dates and events calendar, and a schedule of specific zip codes of brokers and agents who have opted in for extended office hours and enrollment events during the course of open enrollment. I'll now turn it over to Patty Hallebeck to give you a marketing presentation.
Thank you, Janelle. Good afternoon. For the record, I'm Patty Hallebeck with Penna Powers. The outline you have today is a brief look at the campaign that is indeed underway. Sorry, pull this closer. Can everybody hear me okay? Okay.
Now we can, thank you.
Okay, thank you. As mentioned, the campaign launched on October 26th, so this is kind of a preliminary assessment. We certainly have several analytics in place to be able to measure the success of the campaign, but with just 2 weeks underway, there isn't quite enough data, so we're looking at impressions throughout this overview. Also included here, we start out with just some calendars so you can kind of get a brief overview of where we'll be running in which media, the first of which is a television and radio media calendar. You can see the weeks that we're on air. We have 3 TV and radio spots that are running. Each one represents our 3 target audiences, the young millennial, the family, and the older demographic. And we weren't able to show those here, but if they are available via email, if anybody's interested, we can certainly send you a link to see those. The week leading up to the kickoff events on November 1st, we did kind of a 2-layer campaign. So we had our enrollment campaign running as well as specific messaging about the November 1st enrollment events in both the North and the South. Another element to the campaign is outdoor media. And again, both all these pieces are running in both the North and the South. So we have a combination of digital bulletins and posters. The digital bulletins allow us the flexibility to change messaging rather quickly because it is digital. Makes a great opportunity for us to include messaging such as the enrollment events, which we were able to do the week prior to leading up to the events themselves. I've also included here on the handouts a brief review of some of the creative so you can see how it all looks and works together. Moving on to print media, you can see that we'll be running print throughout the campaign. As mentioned in previous presentations, we are working with the Nevada Press Association, which is a group of 17 different publications in the rural areas. So we are able to reach the rural folks in those areas, as well as Hispanic print in both the southern and northern Nevada areas. And again, you can see a couple of layouts of our creative. We obviously have some Hispanic versions as well as English, and those were tagged also for the first week of enrollment with our specific enrollment kickoff messaging. On the next page is just an overview to give you an idea of our estimated impressions for the time period of the kickoff 10/26 until our 12/15 enrollment event. And impressions specifically, what I want to clarify for you, these are actually an opportunity for somebody within our target audience to see a piece of our campaign, our creative, our target audience. So you can see here that on including all our different media together, TV, radio, outdoor, and print, through the time period of 10/26 to 12/15, we estimate that we will touch 40 million impressions. Now, that doesn't necessarily mean 40 individual people. What that means is several of those same people will see the message over and over. And that's key because that speaks to the frequency. That's what we want to do. We want to hit the people in our target audience multiple times. So in Las Vegas, we're projecting 40 million and change, and in Reno, we're projecting 8.5 million and change. And also on the rural print side, it's about 1.5 million that we'll be making impressions for. The next calendar is our digital and online media calendar. That's another important component. You can see coverage for that campaign. And if you look at the next page, that will give you an estimate impression for the time period again of 10/26 through 12/15. of nearly 6 million impressions to the online audience, and that's incredibly important audience. A couple of key points we've noticed just in the last couple of weeks. Approximately 44% of the web visitors from our digital ads are completing a key action, meaning they're clicking on healthcare.gov, they're going to the in-person assistance tool, they're going to the pre-screening tool, or they're going to the contact page on nevadahealthlink.com. So that's a great sign. In addition to that, on our search ads, that we're looking at 18% click-through rate, meaning people are seeing our ads and clicking through to where the ads are actually linking back to the site. The industry standard is about 1%, so we're well over that. So that's a very positive measurement. And then you can see to the right here, so far our top display ad by click-through is our Spanish version of the Get Connected banner. And as I said, moving forward, we'll continue to collect all these analytics, and I'll have much more data available in our next board meeting for you. With regard to social media, again, just to give you an idea of estimated impressions for the 10/26 through 12/15 time period is about 3.2 million. We are doing a paid promotion on Facebook. You can see a couple of the ads here. With regard to Facebook, we've engaged 3,500 individuals, and that's defined as liking, commenting, or sharing some kind of content. Right now, the ads are garnering a 1.39 click-through rate, and again, that's above the industry standard of 1%. About 3,200 clicks are going through to key action pages. Again, these are things like the calculator and other things on NevadaHealthLink.com website. So again, that's a really great sign. The other thing we'd like to mention is because we're targeting our specific audience, we've been able to really see comments coming through that are just kind of neutral. We're not seeing any real negative stuff coming through. And again, that's because what we're doing here is controlling the audience and reaching the people we need to reach, the people who are indeed interested in Nevada Health Link. Moving on to quick PR and media relations summary, we were able to garner some huge media relations leading up to the November 1 kickoff event. We had over 20 stories, and as Mr. Gilbert alluded to, he's been quite busy with the media, which we appreciate. Approximately 94% of the coverage was very positive or balanced, and about 78% of the time there was a SSHIX spokesperson there at the helm, which is great exposure as well. One thing I'd like to point out to you is the estimated value of earned media coverage, and what I mean by earned is we did not pay for this, so it's different. This is coverage that our public relations and media relations teams worked hard to go out and spread the message and achieve this kind of exposure. And you can see a dollar figure here of over $380,000. So that's on top of our paid plan. So we got some great coverage so far, and we continue to land some new and additional media coverage, and we will continue to do that throughout the campaign. On the next 3 pages, you can see specifically the names of the stories and the articles or interviews that took place. And these are actually links, again, online that can click through if anybody's interested. Moving on to just a quick update that Janelle already touched on for the website. As mentioned, a lot of information is now available on the website. We've used one of what we call the pop-up buttons. So with just a simple click, as mentioned, consumers can get to things like enrollment calendars, brokers that are participating by zip code, what their hours are, their contact information, important key information about things they'll need for enrollment, and be able to search by zip code and other ways for specific information. Next is just a brief overview of our broker marketing. So you can see some of the materials we put together to support the brokers. Again, it carries the same theme as our creative, so everything looks consistent and branded so that our consumers get one consistent message that starts to meld together. And lastly, some metrics applied directly to our November 1st enrollment kickoff event before I turn it over for Andres to speak in depth about that. I just wanted to let you know that in Las Vegas, specific to the kickoff event, our messaging garnered approximately 7 million impressions. That means we made 7 million impressions. Again, that doesn't mean necessarily 7 million individual people, but a certain amount of people in our target audience saw the messaging 7 million times. And in the North, it was 1.6 million. And below that are just a couple examples of the specific enrollment messaging that we did for the campaign. We will continue to do this similarly for all of our big milestone events. The next one we have is December 15th, so we'll take the same tact for that. And with that, I'd like to turn it over to Andres to talk about our kickoff events and some additional outreach.
Thank you so much. That was an excellent report. But perhaps going on, there was so much material in there, I would like to actually open that up if anyone has questions. Did I lose the microphone? Did you hear me up there?
We did. Thank you, Madam Chair.
Any questions in the North?
No,
Any
this
questions?
is Angie Wilson for the record. I didn't have any specific question. I just wanted to comment. I went through the material. It just looks so nice, and I love the reports. They're easy to see, but just the branding, the look of the documents, I think look really nice. Even garnered to specific populations as well. I just wanted to comment and say, what a great job the Penna Powers and Ramirez Group have done.
Thank you.
Thank you very much. I would like to go back to where you commented
Madam Chair.
on. Oh, yes.
I'm sorry. This is Valerie Clark. I just had one quick
Valerie,
question.
please.
Sorry.
Valerie, go ahead.
I just had a question about your Las Vegas event on November the 1st, the Charleston campus. You had 800 people. Is that so? My question is, were they all enrolled, or what was the process to deal with 800 people? Did you have enough staff available, and were they sufficiently dealt with?
Andres Ramirez for the record. So yes, our estimated total attendance for the event in Las Vegas was approximately 800 people. That is the total number of people that attended the event, not necessarily the total number of people who enrolled. And so oftentimes what you'll have is you'll have a family, maybe 5 people show up, and that family and that whole family may sign up, or maybe one person in that family will sign up and just the others are there to participate and be part of the process. Some individuals just come to ask for more information or to look for a specific broker. We had some consumers come and tell us that the broker they wanted to enroll with wasn't at our event, and therefore they would go enroll at a later time. Our enrollment events double as health fairs and enrollment events. So some people come specifically just for the health fair portion of it and want to learn about more resources, whether to donate blood or to talk to someone to get a flu shot for their child or to learn more information about the other resources. And so, yes, not all 800 people are enrolled. That's just what we counted off in terms of our estimate of total people who attended both the health fair and the enrollment fair.
Oh, okay. That was my question, was it strictly just for open enrollment, or was it for other things as well? So it was for several other wellness-related activities.
Yeah, Andres Ramirez for the record again. So yes, it was for the whole combination of events, but I do want to clarify in terms of the question that we did have enough staff and resources that if 800 people wanted to enroll, we could have enrolled 800 people at that event.
Oh, great. That's Valerie Clark. That's what I wanted to hear. Thank you.
You're welcome.
Levon Lewis for the record, and thank you for asking that question, because that was the same question that I would have asked. So thank you for that.
Thank you, Yvonne. And I will just follow through with that. This gets back to what Bruce said earlier. It's often very hard at a single event to determine all of those the enrollments that get started that will be follow through to completion. And many of the time, as you pointed out, they are referred to brokers in their own area. Do you, however, actually, at the end, just for your own self, have a way of recording those that actually started and or completed it? And is it actually part of your intention to actually complete enrollments at the first sitting?
So yes to all of the above. So we have developed an online pre-screening tool that we are using for our events. So these large-scale events for the kickoff and the closeout, we work in collaboration with Rosa and the Navigator team to show up and participate. We work in collaboration with Yvonne and the brokers to make sure that we have enough participation. So we have a couple of processes in place. One, whenever a consumer shows up and they want to either learn about the process or see if they qualify, we have an online form where we pre-screen them and we gather some information so that it's available to us electronically. Once we gather that data, then we then assign that consumer to an enrollment professional, for a broker. And that broker who's participating with us in an event has a separate broker portal system that we've developed for the exchange, and it allows them to track whether or not they've actually enrolled that consumer or they're still in the process of enrolling that consumer. And we have access to all of that data so we can see what's happening in real time. Our preference is that we can enroll as many people as possible at the actual sitting. We know that sometimes it's harder to be able to complete a process if you don't complete it. But we also know that there are various situations that will come up with a consumer that maybe they might be asked for some information or some documentation they don't have readily available. And so on the system, they can mark that they began the process, but they need to follow up with the consumer for X, Y, and Z reasons. So we can see what the different scenarios are with that process. And then we're following up with brokers to ensure that they are, in fact, continuing the conversations with the consumers so they can complete that process of enrollment.
So it begs the question, since you have real-time access and you saw what was in process and what was completed, what did you get?
So I want to clarify that comment as well. What we have is the number of applications that have been completed. We don't necessarily have the number of people per application. And so again, one application can include a family of 5, but it only lists as one application for us. So in terms of what we saw for total applications began in that process, I believe that number was 132 applications that were either completed or started during that day.
Excellent. Thank you so much. I'm going to go back to your presentation. A couple of questions. I wanted to first compliment you on the fact that 44% of the web visitors from digital ads completed a key action. I was curious, and I'm going to ask a couple of questions, what you considered a key action, just simply clicking one step forward. Search ads, excellent, 18%, and standard industry, 1%, excellent. That means that you are, as was discussed earlier, doing a good presentation that is encouraging further action. I was wondering on the top display where the Spanish ad was getting, the Spanish Get Connected banner was getting, you said, the best response. If you could give me with the other 2 or 3 runners up and what was versus the difference, how significant was that?
Thank you. I don't have that information with me today, but I can certainly get it for you and will do so.
Thank you. On the Facebook ads, again, it says here, 3,204 websites clicks to key action pages. I'm just wondering what you consider key action pages. Again, it's more definition, and you can certainly bring that back to us.
I can give you a breakdown of the specifics, but what we mean by key action pages are they go straight to the link at nevadahealthlink.com and click on things like the pre-screening calculator, the lookup tool to search by zip code, contact information, those sorts of things. That's what we define as a key action.
That is excellent results then. A couple pages further down, I also wanted to say this is extremely exciting about the estimated earned media coverage, which we are not paying for since we're on a budget. And I know that all that pro bono stuff actually comes from the work you guys are doing, networking and doing outreach to the community. So excellent job. And when you wrote update opportunities and you wrote Las Vegas Review, most of these examples are exactly these upcoming opportunities. That's what your examples are.
Yes, those are confirmed opportunities.
Well, I noticed here that you had 20 positive stories, 94% of coverage, and even though we love hearing all of the good stuff, one of the most important things PR media relations can do for a business is damage control. Did you have any significant issues that require damage control so far since we last saw you?
There really were nothing significant. I think based on some of the past, there's still a tinge of a certain sentiment out there, and from a wider editorial position, that was reflected in a few of the articles, but there was nothing specific that we really felt we had to spin doctor in an urgent matter.
Thank you very much. You're off the hook for the last question since I can't read this doctor's handwriting. Mr. Ramirez, would you like to continue?
Thank you, Chairwoman Jameson. I just want to add a couple of comments before Patty finishes her presentation. Her team, along with Fast Foley Warren, have done an incredible job of getting some media coverage and working. I'm glad to be part of that team. And they've generated some impressive results. I do want to note that it's not a complete picture. There was a lot of work they put into as well in Spanish language media, and so we have a lot of stories that aren't included in this report. I take personal responsibility for that, for not having been able to get the clips and aggregate them for their reports, but that would add to the impressions and the reach that they did during this pass. And so I do want to make sure that we note that it was even a lot more than what's included in this report, and we're hoping to have those aggregated mentions in a future report.
Well noted, and that means we will hold you to that.
Yes. I will hold myself to it, or I will hold Janet accountable for that, one of the two. I also just want to start off by saying that the outreach events that we did on November 1st, by several measures, were extremely successful. And one of the reasons why, Dr. Jameson, as you mentioned, is that we have been leveraging our networks of partnerships and resources with other entities so that we can be very effective at the work that we're doing. And so, for example, we did this event at CSN, and one of the reasons we chose CSN was because it's in a key location for a target audience that we're looking at. In fact, 4 of the top 10 zip codes that we're targeting surround the CSN West Charleston campus. But on top of that, Dr. Richards, who's the president of CSN, him and his team were extremely gracious, and they essentially comped most of the cost to hold the event at their service. So we didn't have to pay for the facility, we didn't have to pay for Wi-Fi, we didn't have to pay for the extra rooms that we used. They provided security and so forth. And so the partnership we were able to develop, because they knew the importance of this event and what it could mean for their own students who are attending, was a great collaboration that allowed us to maximize our resources for better marketing and outreach purposes. And so I do want to make sure that we put on the record that it's, Dr. Richards at CSN, really helped us out, as well as the Boys and Girls Club of Reno, who also did not charge us for use of their space while they did the event. So those were great benefits and perks we were able to utilize by leveraging our existing relationships with community partners so that we can, again, make more efficient use of our resources for the exchange. Outside of that, I also want to just talk, kickoff this year, Executive Director Gilbert mentioned we keep changing the open enrollment dates of when we start. So each year it's been a different date for the past 3 times. And so this year it was November 1st, and November 1st fell on a Sunday. And not only did it fall on a Sunday, but it fell on a holiday weekend. And so that certainly complicated a lot of our efforts. We would have liked to have had better attendance, but we knew that we don't get to set the date. And so we had to work with the date we were given and work with attendance on that front. Having said that, I think the attendance we did get was good given the circumstances. But we are looking at how we learn from those existing structures that we have to work with. So at our event for Sunday, November 1st here in Las Vegas, we had 50 exhibitors participate in the health fair, which was great. We also had at least 50 brokers participate in enrolling. We had 40 navigators show up to help us with the process, and we had over 100 high school volunteers in Southern Nevada who showed up to help with the event. So from that logistical standpoint, I think it went great. Media showed up, they covered the event, we had people show up, they were enrolled, those who can, and so forth. In Reno, Nevada as well, we had about 10 exhibitors who showed up for our Reno health fair, and we had 19 brokers who registered for the event, and we had a sorority from UNR assign their sisters to come volunteer to help us manage the event in Reno. It was at the Boys and Girls Club. Yeah. So we were able to put together the logistics so that if we got inundated with people, we had enough volunteers and enrollment professionals available to handle the crowd. That didn't happen, but we were prepared in case he did. So with that, we have been talking with several of our exhibitors, enrollment partners, and other professionals. The closeout, January 31st, also falls on a Sunday. And we're finding that it is increasingly challenging to get venues and get exhibitors and to get staff and to get people available for another Sunday event. And since we already did a Sunday event for kickoff, we are recommending that we shift the closeout event to Saturday, January 30th, which we think will help with turnout, help with with participation of exhibitors and volunteers. And so we are working with our venue to shift the event to Saturday. We are working with SSHIX, and they have given us their blessing and permission to move forward with a Saturday event. And so as soon as we confirm all the logistics for how that will work, we will make sure that we notify the board on how that process is going.
Excellent. I think that will allow you to have another stellar closeout event if you shift to Saturday. Were there any comments or questions? And I'm looking for hands up north.
Madam Chair, if
Yes,
I may.
Mr. Gilbert.
Thank you. And it truly is a comment rather than a question. I had the opportunity to be down at CSN for the kickoff and to take a look at the facilities and what was going on there. And I will share with you my opinion that despite the fact that it was a low turnout, and I understand why that was, Sunday, holiday weekend, day after Halloween, really, really tough. The truth is the facilities were top notch. Penna and Mr. Ramirez did an outstanding job. The screening that was being done by the navigators, again, flat out top notch, really well done. The turnout of the brokers, the broker community showed that they're definitely with us. That was a wonderful thing to see. And as you asked of Mr. Ramirez, we are working very hard to make sure that we are able to track the process and make sure we understand what's going on at each of these events. Last year people handed in cards, and sometimes they did, sometimes they didn't. It's a whole new era now, and I could not be more pleased than what I saw down there at CSN.
Thank you, Mr. Gilbert. And just following up on what you said, it was, the holiday week, Nevada Day and all of that. Everybody who can gets out of town, takes the last, and so it was really tough, and you guys really did good. I think I saw another hand up there.
Yeah.
Please
Cliff
proceed.
King, Division of Insurance, and we did have a representative down in Las Vegas, but unfortunately, he had the opportunity to talk to nobody. The vendors were placed outside on the building side where the people come in and out on the other side of the building. They never even saw him. Glenn couldn't even see who was coming, who was going, anything else. So frankly, they were gone by noon. And so just one comment about that is that the placement of the vendors probably needs some adjustment. In the north, I happen to be up there, and we at least were inside on a cold, windy Sunday morning, but we probably ought to have coffee next time. And because you're not near a facility where you could easily go get a cup of coffee or anything. So that's the only 2 cents I got thrown out.
Much appreciated. Location and coffee are very critical. Mr. Ramirez, you'll tend to that. You know, that is a common issue that sometimes vendors get put outside, and they shouldn't be considered second, third circle. They should be inner circle. And maybe comments?
Sure. So I can assure you, Mr. Commissioner, that the people in the South had access to coffee and warm food. So we made sure that that happened at CSN. The way the facility was designed is CSN has an outdoor courtyard where they set up exhibitors. It's a common area. It's actually the first area that the traditional public get to when they show up at the event. So our main information desk, our bouncy houses, our emergency personnel were all up front outside with the exhibitors because we knew that would be the main point of entry. But we did get feedback from several exhibitors that didn't feel that the traffic went through their side enough. And so part of our closeout is we are designing the layout so that it will force consumers to go through the exhibitor side before they can get to the enrollment side. That way exhibitors get as much traffic as the enrollment room.
Excellent. Any other comments or questions? Any questions? Any hands down here? I did remember the question that I had earlier on your marketing. It was on the material supplied for the brokers. And it is, again, beautiful material. I'm wondering, is it given to every broker who's a participant or only if the brokers call and request it?
That is correct. It's the brokers who participated and worked directly with Yvonne to set up and coordinate receiving the materials. Once they did so, they were able to receive any of the materials that they needed.
So again, the brokers that spoke with Yvonne, meaning of those brokers involved participating with us, what was the number we said last time? 450 roughly. And so did Yvonne, did all 450 offices receive materials? I ask this question because we do, as we knew when we set out several years ago, as it all progressed, the brokers would be who we heavily rely on for enrollment.
An email was sent out to our listserv notifying them that they could come pick up materials on Monday, Wednesday, and Friday from our location as well as the Carson City location, and everything was on a first-come, first-served basis.
So then, to answer my question, how many brokers or broker offices picked up materials of the 450 participants?
Of the 450, I did not keep track of how many I distributed, but a heavy sum was distributed amongst all of them. We kept track of only the ones who requested A-frames.
It would be nice to have that figure if we got material out available to 50 broker offices or 100 brokers of our 150. I think this is an important thing for you to follow through on.
Yes, ma'am.
Are there any other questions? Okay, then let us, oh, I missed one. I'm so sorry.
I just have one clarification. Did you say 150 brokers or 450 brokers? 450 brokers, that's what I thought. Thank you.
I would like to thank you very much for that wonderful presentation. And if there are no other comments from you or the rest of the board, then we will go ahead and go on to the call center update.
Okay, for the record, my name is Heather Korbulik. I'm the operations manager with the Silver State Health Insurance Exchange. I'm going to give you an overview of the last quarter with the Consumer Assistance Center. the data that we collect is from two different systems. It's from our call management system, which logs the number and frequency and hold times for our calls. And then we also have a customer relations management tool, which logs the sort of topics that callers are calling about. In our first two charts, you can see these are both quarterly charts, and you can see in table 1 that we're looking at the number of abandoned calls, which is hovering near 0, and the number of calls, which has gone down a slight bit in the month of October. We don't have statistics yet for the entire month of November, which of course would represent our open enrollment period, but I can tell you that in our first week of open enrollment, the call center received close to 600 calls. In table 2, you're seeing the average abandoned call time and the average hold time, which are hovering near 0. And then the average time that is on the call is around 3 minutes per call. In table 3, you can see a breakdown of the top 5 different topics that our consumers are calling about. In general, most of them are being forwarded to healthcare.gov. Oftentimes, those calls are with assistance from our consumer center staff. They will make a call with the consumer and help them through the enrollment process or whatever their questions might be for healthcare.gov. Also, a lot of the calls are going to Medicaid or to Nevada Checkup. We have some callers still continuing to follow up on their 1095As. Some are just calling about general education, and some of them are calling about their insurance carrier. A couple of challenges that the consumer call center still has. We're still processing 1095A corrections, and we processed 203 1095A corrections and issued 581, I have a typo there, sorry, 1095A reprints. So we assisted 784 of our exchange consumers with their 1095s. The exchange has received contact information for some of the consumers who might be impacted by the failure to reconcile, and the call center has begun to reach out to those individuals, making calls out to assist them with any corrective measures that they may need to take to get that situation corrected in time for open enrollment. I'd be happy to take any questions.
Do we have any questions up north on the call center activity?
None up north, Madam Chair.
And do we have any questions down here on call center activity?
Lavon Lewis for the record. I'm just curious, have we finally reconciled all of the problems that we had with the previous provider? Xerox, yes.
Madam Chair, if I may respond to that. I don't know that we will ever, I don't know that we will ever reconcile all of the problems which we had with the previous vendor. I think that we've sort of reached an equipoise where there are no new problems coming, and slowly but surely the old problems are fading away. But I would be very hesitant to say that there won't be problems which may crop up in the future.
Thank you very much, Mr. Gilbert. Actually, I think this is a terrific graph and is very self-explanatory about call center activity. We know that graphs never tell the whole story. I would anticipate with the functioning call center that you guys have been pretty much able to redirect the calls with regarding the Nevada Co-op well, and I believe those are going to probably be buried in some of these like insurance carrier ones. I was surprised that insurance carrier questions were so low. And how was was it a very significant issue handling the questions on Nevada Co-op? In the private offices, there seemed to be a lot of concern, and yet when I know people went to the exchange, to the call center, I think they felt straightened out about everything. Do you have any comments on that?
can say that we did, for the record, Heather Korbulik, I can say that we didn't receive very many calls from consumers about the co-op. And when we did receive those calls, we were able to put most minds at ease, letting them know that CMS and the Division of Insurance have told us that those plans will be in effect through the month of December. And we have been making sure that they understand that they will need to re-enroll actively. And that means going to healthcare.gov or to a broker navigator to get re-enrolled in a new plan.
Excellent. I mean, such a big role for us is the direction and reassuring our clients, our customers, and the people of Nevada. And I think you guys are doing a great job. That is the beauty of our Silver State Exchange, is that really the call center and your human voice is what they can reach out and touch when they're a little scared. And I think you guys have reassured them across the board in so many issues and are doing a great job. Are there any other questions? Okay. Moving on, discussion and possible actions regarding dates, times, and agenda items for the future meetings. I do not see any hands. Jose, do you see any hands up there? No hands. Okay. Public comment in the north?
There is no public comment in the north, Madam Chair.
And is there any public comment here in the south? Excellent. Then I would entertain a motion to adjourn.
Motion to adjourn.
Second. Valerie Clark,
And
second.
we are adjourned. I would like to thank everyone for your attendance and the staff for their excellent preparation for this meeting. Thank you, Mr. Gilbert, for the great job you're doing.
Thank you very much.